Good morning. Welcome to day 3 of the Coalition's 41st Annual Conference. Thanks for joining us for the final day of the conference. On behalf of the Coalition's Board of Directors, the Education and Wellness Committee, and the Coalition staff, and of course myself, I want to let you know how much we appreciate your engagement in this year's annual conference. The virtual 3-day, 2-hour-a-day format has been a new experience for us all. And, you never know how something like this is going to go when it's completely different than anything you've tried before. And also, it's in a environment, if I can put it that way, where we hear from folks consistently how Zoom meetings out they are. And we're hearing even over the course of the last couple of days how much people want to be in person. But, even given all that, I want to thank all of you who have attended and made the conference a success. Attendance has been great. There's been great energy in the networking, and we really appreciate all the positive comments we're getting about the networking platform. And I do not want to forget to thank the team from Remo for the great work they've done for us over the 3 days. They're a great group to work with. In addition, Dr. Berwick's keynote and the panels on innovation in healthcare, pharmacy, and employee benefits, I think has given us a lot to think about as we move into the future. We hope that, as I've said the last 2 days, we hope that this year's conference is starting to get us back to normalcy, and we'll soon be meeting in person. With today's program, the theme is the future of mental health. Next slide, please. Today's program theme is the future of mental health. With the pandemic, the state of mental health in the country has been pushed to the forefront. And I don't want to forget to mention that May is Mental Health Month. This year, the Coalition has been focused on mental health in several ways. We planned our 3 major educational events around mental health. So in February, we had the Lehigh Symposium, which had a panel discussion on mental health from a systems perspective. Of course, our program today is on mental health. And then in September, our documentary film screening and panel is being planned around mental health. I want to thank our keynote today, Craig Kramer, and the panel for being with us today. I want to thank everyone, all of them, for their partnership with the Coalition. Next slide. A few housekeeping things. Networking we had this morning, and we'll have another session following the panel at 1 o'clock. During presentations, attendees are in listen-only mode. And the event is being recorded, and we expect the recording to be out next week. Then remember to use the Q&A to submit questions, and they'll be answered live during the panel. Next slide. The daily survey yesterday, was completed by, I believe, over 50 people, and the first day survey was completed by over 80 people, so that's fantastic. We appreciate that. And we are awarding a gift card for completing the survey. And yesterday's winner, I want to congratulate Mary Lou Cabali, County of Northampton and Graysdale. You've won a $50 gift card, and it's sponsored by AmeriHealth Administrators. You'll get another survey today, and please complete it, and there will be a awarding of another $50 gift card. And also, I just want to say, if you haven't completed a survey from day 1 or day 2, it's still not too late to do that. I want to recognize our sponsors. Can't thank our sponsors enough for their continued support of the Coalition. You see our premier sponsors on this slide. Thank them all. Next slide. We have our platinum sponsors. Again, thanks to all of them. Next slide. Our gold and silver sponsors, a few more on this slide, so just take a second. I want to thank them all and appreciate all for their partnership and relationship with the Coalition. Next slide. I have, as I have the last 2 days, just want to remind everyone, we have 2 events that we're announcing as being planned for in-person events. The first is the 4th annual documentary screening, which we partner with Lehigh University's Healthcare Systems Engineering program on, and that's scheduled for Tuesday, the September 14th. And at Arts Quest. And then, as we normally do, we're announcing next year's conference date. So the 42nd annual conference is scheduled for Wednesday, May 11th at DeSales University, and of course, in person. Just before we move to our presenter, I want to thank the coalition staff. I can't tell you how much work they've done on this, and even over the last 3 days, how much work is being done in the background to keep things working. So thanks to Amanda, Donna, and Wendy for their great work with this and everything they do for the coalition. So now it's my pleasure to introduce our keynote speaker, Craig Kramer. Craig Kramer is the Mental Health Ambassador and Chair of the Global Campaign for Mental Health in Neuroscience External Affairs at Janssen Research and Development, a Johnson & Johnson company. In this capacity, Craig leads a Johnson & Johnson team that seeks to transform mental health care globally by raising awareness, reducing stigma, promoting research, improving access, and ensuring better patient outcomes. Key initiatives include a global leaders coalition to champion proven, scalable reforms, including next-in-class workplace mental health practices. Prior to this role, Craig held a variety of positions in global corporate and government affairs at Johnson & Johnson and worked as a lawyer in the U.S. Congress, a Washington, D.C. law firm, and an international human rights organization. With us today to talk about the mental health moment, my pleasure to introduce Craig Kramer. Craig?
Thank you, Carl. My journey to speaking to you today really started with a phone call from my daughter. And I answered the phone and said, it was on New Year's Day, by the way. And I said, "Hey, Catherine, how's it going? Happy New Year." Because like many of you, I'm a dorky dad. And a man's voice came on the phone. Now, I knew she'd been on a first date the night before, New Year's Eve, so this was awkward. And the man said, "Are you Catherine's father?" And I said, yes, I am. And then the man said, "This is the Boston Police Department. Your daughter tried to kill herself. We're taking her to the hospital. You need to get up here right away." My daughter had suffered with an eating disorder. And if you know anything about this awful illness, every bite of life-sustaining food is torture. Every piece of clothing makes you feel miserable, too fat, too skinny. And after 10 years, she had given up hope that it was ever going to get better. And as we drove up to Boston, we thought about, when we discovered the issue, our daughter had been playing on one of the top teenage girls soccer teams in the country. Some of her teammates and competitors were on the women's national team that won the World Cup in France 2 summers ago. And at this one particular game, there was a soccer mom from the other team who was walking up and down the sidelines telling everybody who would listen that my daughter was anorexic. And my first reaction was indignation. I mean, how dare anybody body shame a teenage girl, especially for a body that they inherited. But I'll never forget looking out on the soccer pitch and knowing that this mother was right. Now, my wife and I did what any parent would do, any of you would do. We took our daughter to the pediatrician. And looking back over all the years, that was our first major mistake. My wife and I are lawyers by training, and we did not know that primary care doctors, pediatricians in the United States, especially at that time, received very little training in mental health. It was an average of half a day training in their 4 years of medical school. And so when our pediatrician persuaded our daughter to keep her weight where it was as a young teenager, we went along with that. We thought that was a medical victory. But he didn't know, and we didn't know that, like any other illness, if you don't treat, cut on the arm or cancer, if you don't treat mental illness, it can get worse. And yet we did nothing to treat the underlying condition. We didn't know that mental illness, that eating disorders are the deadliest mental illnesses. 23 deaths a day in the United States from the effects of suicide and starvation. We didn't know that half of all mental illness begins by the age of 14, which was the age my daughter was on that soccer pitch. And another 25% of mental illness, or 75% of all mental illness, starts manifesting by the age of 24, which coincidentally was the age she was when I got that phone call. We didn't know that, unlike other areas of healthcare, mental health is not integrated with primary care. So you're sent out into the wilderness, and in my part of the country, it literally is into the wilderness. You're out in the middle of the woods. People don't want to be seen going to mental health care. But you have very little guidance, very little guidebooks to help you, based on science and data, to help you choose among the many flavors of mental health care. We didn't know that a lot of mental health care, again, unlike other parts of healthcare, is not covered by insurance or is not in network. At one point, we got our daughter into one of these residential facilities, and she would call almost every day to tell us that one of her new friends was being sent home because she had gained a pound or two, and insurance was cutting off, even though the underlying mental health condition was not being addressed. We work in healthcare, Johnson & Johnson, but we didn't know that in the field of mental health, the advocacy and research communities are very fragmented and underfunded. And so their voice is not heard in the halls of power in our country. And we didn't know that because of all this dysfunction, the family has to become the mental health system for their loved one. And we surely did not know that extra burden can crush your family, it can destroy your marriage. It did ours. And it can make you so tired. I mean, imagine going to bed every night wondering if your daughter's going to be alive in the morning. So tired that it's difficult to go to work and function and let alone care about the project that's due on Friday. We later discovered that this dysfunction applied not just to eating disorders, but to depression, anxiety, addiction, post-traumatic, postpartum, obsessive-compulsive, bipolar, schizophrenia, other disorders. And it's not just the United States. At the time, I was vice president of international government relations for Johnson & Johnson, and I started to ask health ministers and hospital CEOs and doctors and patients about mental health in their country. And I found out it was really the same everywhere. In fact, the WHO, World Health Organization, now says that when it comes to mental health, every country is a developing country. That's surely true here in the United States. So, the system, if you can even call it that, is broken. It doesn't work. Something has to be done. And one day I was watching a documentary by Ken Burns about cancer. It was called The Emperor of All Maladies, a biography of cancer, based on the best-selling book by Siddhartha Mukherjee. Many of you probably read it or saw the documentary. And in the documentary, they said that 100 years ago, if you got cancer, we would lock you away. And they showed a picture of these children who were sent to a hospital ward to die with a kind of cancer called leukemia, blood cancer. And it hit me like a thunderbolt that here we are 100 years and some later, and if you have mental illness, we lock you away. We do the same thing. In the United States, the three largest mental health facilities are the jails in Chicago, LA, and New York. And if you're privileged, as I have been, to go travel internationally, you'll see similar things all over the planet. Even in small villages, you'll see a person with mental illness chained to a pole or inside of a hut so that the family can go out to the fields or the markets for work and make sure that their loved one is safe and that the community property is safe. So, and if we don't lock you away physically, we lock you away socially. We ostracize you. Nobody wants to be near the crazy person. And, we do it for the same reasons we did it for cancer. With cancer, they thought it was communicable. Many people think that their children are going to catch, mental illness from somebody who's crazy, or a child who has an eating disorder. We think we thought with cancer you were somehow cursed, and today we think you're cursed either because you have character flaws, you lack discipline, or you have bad parents who didn't teach you how to, have good values and live responsibly and intentionally. And then finally, at the time there was no cure for cancer 100 years ago. Today we think there's no cure for mental illness, that you're just kind of, once you got it, your life is over, and that could not be more wrong. And I'll talk a little bit more about that in a second. It occurred to me in that moment, it turns out I'm not the first person, probably the 1 millionth person to have this idea, but we need to do for mental health what we did for cancer. And in addition to my experience at J&J, where we were in the center of the cancer fight, my father had cancer about 3 years ago now, and it was a pretty tough form of cancer. He's doing well today. But it was a very different experience than the one I had with my daughter, because with cancer, everybody knows the basic vocabulary. The primary care doctors know so much about it that he actually stayed with us on the conference calls with the surgeon, with the oncologist, with the radiologist, and helped us guide through the process. And then there was enough data collected over decades that you pretty much know on day one what your prospects are, 5-year survival rates, and whether you can go with existing treatments or whether you want to get into the many clinical trials that are available for different forms of cancer today. So, how do we bring that about for mental health? And, frankly, at this point in my story, I thought this was going to be an easy thing. I mean, I've been in the front lines of the HIV struggle and pandemics, Ebola, and now COVID-19, cancer, diabetes. And I thought my family was uniquely unlucky. I hadn't heard much about mental health up to that point. I also knew that in our research and development budget at Johnson & Johnson, about 5% was going to neuroscience. And so I thought that was probably about the scale of this thing. And I thought I would just sort of add it on to my day job, which was shaping policy around healthcare. And I went to the head of our neuroscience research division, Husseini Manji, who thankfully is a Canadian. And I said, Husseini, I've got this, this very strange skill set. I know how to build coalitions and change health systems and improve outcomes for patients and create sustainable solutions. And I'd like to help you, fix mental health. And because he's Canadian, he didn't laugh at me or belittle me. He was very kind, and he said, "Well, let me give you some reading to do." And so I went away, and I got a real education. I was blown away by what I learned. Let me just start by saying the World Economic Forum did an analysis of all illnesses, and they discovered, to their surprise, that in the coming decades, mental illness will account for more than half of the economic burden. That's not just the healthcare system cost, but the whole societal burden. More than half of the economic burden of all chronic diseases, more than the combination of cancer and diabetes and asthma and other chronic respiratory conditions. It's a huge burden, unmet need. Now, why? I mean, how could that be, right? Well, first of all, mental illness is a lot more common than we think. It's 1 out of 4 of us by most measures. It's also the only chronic disease of the young. The other diseases I mentioned happen late in life. This one starts early, as I already discussed. And because it largely goes untreated, 2/3 of people around the world get no care at all. And the third who do, like my family, wait an average of 8 to 10 years before they sift through the stigma and find quality care that can actually meet their needs. And as a result, these illnesses progress and continue over a lifetime. And so the economic costs pile up over that period. into the tens of trillions of dollars in the coming decades. And then another thing that's exacerbating or amplifying this effect is that we are increasingly in this knowledge-based economy. I grew up in Detroit. You could aspire to get a good job down at the auto factories, performing basically repetitive physical tasks. Those are all automated now, and whether you are working at McDonald's, where I started my work career, or any other job that you have today, you almost always have to have enough cognitive function to innovate and collaborate. The two hallmarks of the modern economy. And so that has amplified the impact of mental disorders on the economic life of our society. And you're starting to see this in the headlines now. Even before the pandemic, you might recall that in the United States, we had 3 years of declining life expectancy. 3 years in a row of declining life expectancy. The last time that happened was 100 years ago. There's that century, and it was at the confluence of World War I and the Spanish influenza of 1918. Those things, as you know, as we now all know, they kind of overlap. That was the last time we had 3 years of declining life expectancy. What was going on before the pandemic? Well, right now it's being driven by two preventable outcomes of mental illness: suicide and drug overdose. And I think most analysts believe that the COVID pandemic is going to have a long tail of mental stress and disorders. So I think we're going to see these kind of effects continue. So this is a huge problem, right? And if you go again outside the United States, you're going to find similar shocking statistics. And the one that really spoke to me was that in recent years, for the first time in recorded human history, the leading cause of death for teenage girls, our teenage girls, ages 15 to 19, is no longer childbirth. In recent years, it has been suicide. And there are a lot of reasons for that, which I don't have time to go into. But I really felt like those girls were calling out to me like my daughter did. And I believe they're calling out to all of us, and they're saying, where is the leadership to put this on the agenda, like climate change, like HIV in a previous generation, like COVID-19 today, which kind of put itself on the agenda. But how do we get this resource and address this thing once and for all? And so, these were a lot of terrible numbers, and if it was all terrible, I wouldn't be here talking to you today. Fortunately, in the reading that Husseini gave me, there were some positive trends that were very exciting. First and foremost is that young people are throwing off the chains of stigma around the world. It's not just a U.S. phenomenon that we're all familiar with, but young people are talking more openly about mental illness and really changing the paradigm. And they're starting to arrive in our workforces, just like an early generation of LGBTQ employees arrived on our doorsteps and said, we want to come out of the closet and we want to change the culture and get the kind of support that we need to live our authentic selves and be healthy. Another great trend is in neuroscience. They're already calling this the golden age of neuroscience because even lay people like me have seen the photographs of the brain, and you can see the brain firing in response to stimuli, and you can kind of reverse engineer that to come up with new treatments and approaches, whether it's talk therapy or electrical stimulation or pharmaceuticals. There's a whole new era coming in the near future. Technology is playing a role. I mean, you've probably seen the digital apps, but interesting thing about the phone that brought me the bad news is that it collects a lot of indicators of early mental health. So it tracks your sleep patterns. So that's one of the first things it starts to change. It tracks your social isolation. How many snaps and posts and tweets and phone calls do you do? It also can track your physical isolation. So how many steps do you take? It can be paired with a voice imprint analyzer to detect stress in your voice, or a Fitbit type device to detect the stress hormone cortisol on the surface of your skin. And so, again, I'm an auto guy from Detroit. Just like that car has that check engine light, doesn't mean the car is broken. It means go get the oil checked or the tire pressure checked. You may be able to sign up soon for an app that gives you a check engine light for your brain. it says algorithmically you're moving from sort of a safe space to a disordered space, and before it gets clinically, critical, go get a checkup from the neck up, right? Just like you would for your car. Other positive trends is that law enforcement and the military, which has been battling, the PTSD and suicide struggles, they're saying, hey, look, this is not what we do well. Take us off the front lines. And schools where young people live, and primary care doctors and parents are saying, look, we need to be part of the solution because it's having such a big outsized effect. Employers are getting involved. Governments are starting to see the impact on their economic life. About 4% of GDP is lost every year because of untreated mental illness. For those of you who are economic wonks, that's a big number. It's one of the few things you can actually move the dial on. And so there are a lot of positive trends happening. And one of the most positive things is that we actually know a lot about what works if we can treat mental illness early. Even for the most severe forms like schizophrenia, there are studies around the world that show if you can intervene either before or right after the first psychotic episode, you can deflect the trajectory of that illness substantially with known approaches. And again, more approaches are coming. So we don't do enough with what we already know, and that's an opportunity. So, it turns out, I wasn't unique. My family's not unique. But Husseini and I were unique in at least one way. We work for the largest healthcare company in the world that has this amazing network of health ministers and prime ministers and patients and doctors around the world. And so we have now committed our organization to trying to make a difference, as Carl said, to really transform mental health care worldwide. That's our goal. And I want to walk you through a couple of things we're doing and as a way of showing that there are things that all of us can do. You can do in your enterprise or your organization or as individuals to really help bring about this new future that we need to create. And we're, to simplify, we're focusing on three broad areas: science, culture, and system change. So science is sort of the heart of what we do. We're doing that now with the COVID-19 vaccine. We've done it with HIV. HIV has gone, in my lifetime, from a death sentence to now it's a chronic illness. And we and others are working on vaccines that are fairly late stages of development that would make HIV a preventable illness. A remarkable set of progress. So how do we bring that same kind of scientific progress to mental health? Going back to the cancer example, 100 years ago, we knew there was blood cancer. Today, because of decades of scientific research, we know that there's 51 different types of leukemia and counting. And we know there are a variety of ways to attack those cancer cells, either starving it of nutrition or doing something on the surface of the cell or getting inside the cell. And so someday, I hope we'll have the similar types of understanding of mental illnesses. We already know that schizophrenia has over 160 genes that are implicated, but we don't know exactly how they work. And maybe there'll come a day where we know that there are actually many different constellations of these genes acting in many different types of schizophrenia and different approaches. That's how science can drive change. And also, with HIV, when the medicines finally came around, it really started to remove the stigma from HIV because now you can get better and you can get treated. So science can drive the culture change as well. So that's one big area. We are, one of our big projects this year is working with the World Health Organization, the World Bank, UNICEF, the Children's Agency, and others to create a global fund for mental health research and implementation, similar to the Global Fund for HIV from like 20 years ago, that really turned the tide on the HIV epidemic. So that's science. The second area is culture, and this is really going after the stigma. As I say, one of the most gratifying things I've been able to do, all of us can do, is working with the young people. They're out there, they're speaking, but they're often fragmented, just like the whole mental health system. And so we've tried to bring people together and really just connect them and then watch what happens. We've also tried to provide leadership training and nonprofit management training so that they can amplify their effect. But as a result of our collective efforts, there are now several global coalitions of advocacy. One is called United for Global Mental Health. Another one is the Global Coalition for Youth Mental Health. And they are driving the conversation, are driving activism in a more coordinated, systematic way. So that's one aspect of the stigma campaigns. And one of our projects this year is to bring together the leading anti-stigma campaigns, probably under the auspices of the World Economic Forum, to have a conversation about how we can align our messages, because if your experience is like mine, my family's still very confused about mental health, even though I don't spend a lot of time on this, because there are too many messages, they're too conflicting often. And so we're going to convene these groups and let them sort out for themselves what's the most effective way to change the conversation permanently in mental health and align our voices. Another aspect of culture change are celebrities. We had worked previously with a thing called Stand Up to Cancer. You might have seen their telethons. And it's really just a platform for celebrities who care about cancer to all align their messages, get a clear voice out there, and raise money for change in science. So this past summer, with a group of wonderful collaborators, we launched the Well-Beings campaign. And it's doing a 35-city tour around the United States right now. It's all virtual. There's one in Detroit last week. But if you go to Well-Beings, you can join the movement and see all the wonderful celebrities. By celebrities, we mean anybody in front of a camera, singers, actors, athletes, talk show hosts, news anchors, anybody behind the camera, executive CEOs, content providers, writers, screenwriters, people who create content, write movies and so forth, producers. And now there's a common platform where people can raise their voice. Again, they were already doing it in a fragmented way. Michael Phelps, Lady Gaga, Justin Bieber, everybody's talking about how do we get it together so it really breaks through and the stigma reduces. So that's the culture piece. And again, you can do this locally. You don't have to be working globally like we're able to do. And then so it's science, culture, and then system change, because as we've learned with systemic racism, we've had decades of consciousness raising in corporations and other places. But if the system doesn't reinforce the culture change, the system wins every time. And as I've described, the system is badly broken in mental health. And so we are putting our hat in the ring to work with others to try to change the system. One in the United States, the Path Forward initiative, of which many of us here are a part, is trying to take the collective purchasing power of large enterprises, whether it's labor union plans or private sector plans like ours or government plans, and work with payers and providers to change the system, have more in-network provision of health, more evidence-based treatment as a first line, more collection of data so we can see long-term outcomes and move the system accordingly. We've also are working at the national level with the national response to COVID-19 on suicide and mental health. A lot of stakeholders from the public and private sector. And then, what we discovered is as we had these conversations, our own internal system started to change. So we now have, for the first time, 2 people who wake up every morning thinking about how to improve our employees' mental health journey within our benefit structure. We also have, our employees were so excited, we created the very first employee group for people who live with mental illness, either as a patient themselves or as a caregiver. So we previously had groups for LGBTQ and women and minorities and veterans, and now we have an employee group for people with mental illness, and they're changing the conversation. They're telling their stories. They're getting support. They're helping us identify gaps. And one example was when I went out to Singapore, I was complaining about the United States not covering all mental health, and somebody raised their hand and said, "Well, wait a minute. Mental health is covered in the United States." Well, it turns out in Singapore, the marketplace had never evolved to have any mental health coverage. It was always considered something outside of health insurance. And so we now work with other employers and with payers to create products that cover that gap. So those kind of system changes are happening organically internally now because of this overall conversation. And I want to sort of give one example of how all these pieces come together. Our employee groups, they raise awareness, they provide mutual support. Think about LGBTQ for a moment. They also do philanthropy. They work with nonprofits in their community to strengthen them and get the word out. But the other thing that our employee groups do is they recruit from universities. So again, LGBTQ goes out to universities and says, hey, come to Johnson & Johnson because we have an environment that's going to embrace you and support you and empower you, and then you can work on all these great healthcare challenges. And I thought it was going to be a while before our mental health group had a chance to go out and recruit, because I just didn't know if our organization was ready to start recruiting people who have mental illness. But one of our young millennials in recruiting called me one day. I don't think she really knew that she was crossing this new barrier. But she said, hey, you're the latest employee group. Can you come out to Cornell Business School and tell the students about what you're working on? And I got to say, it was a magical experience. We've now done it at dozens of universities. But we said, hey, we know that 1 out of 4 of you have these conditions, and probably 2 out of 4 of you are caring for somebody at home, just like the rest of us. We know that you're coming out of a generation that talks about this more openly than any generation in history. And we know you don't want to go back in the closet because that'll be bad for your mental health. So come to J&J. But don't come only because you're afraid no one else will let you be who you want to be. Come because you have all the leadership qualities we're looking for. We are looking for what we call, the business schools call servant leaders. Gone are the days when a leader can dictate the results. We need people who can serve their teams and draw out the best in the teams, especially diverse teams. And servant leaders have 4 qualities. Number 1, they're humble. And if you have a mental illness, you know you're not perfect. Number 2, they have empathy. And if you have suffered, you recognize it in others. Number 3, servant leaders are, as I say, they incubate and draw innovation and creativity. They're open-minded. And if you've struggled through this broken health system, you've had to hack the health system, you had to hack the stigma, and you oftentimes had to hack your own mind and thoughts. You are the kind of leader that we're looking for. And finally, leaders have grit. Servant leaders have grit, and if you've been struggling with mental illness, that's kind of your calling card. So you have all the qualities we're looking for in the 21st century for leaders. Come be a leader at J&J, and maybe someday be the first CEO to talk openly about their mental health challenges. So, in closing, look, we got a long way to go. We're talking about massive culture change, massive system change, and significant scientific developments. But every disease has a turning point. And I mentioned the negative things, but I also mentioned the positive trends. We're at an inflection point. And I believe, and my company believes, we're moving through that inflection point to this new time. That's why we call this the mental health moment. Pandemic, I think, has brought this to life for everybody. We all know mental health is a daily struggle for every single person. And so now is a great time to push forward to this future. And so we can all begin to talk about how this is just a normal part of the human condition. I mean, 1 out of 4 people at some point in their lifetime are young people. So we can start taking casseroles to each other's homes when you have a mental health crisis, just like we do when you have cancer or a heart attack. We can begin to teach our children who are on the front lines as much about their mental health as we already teach them about their dental health. What's the brain equivalent of flossing and brushing? How do we get that into the kids so they know how to cope and identify these things early on? And we can all, change the conversation and say this is not about character flaws. This is largely about chemistry. Now, on the 5th anniversary of the phone call that I mentioned at the beginning, my family decided to mark the occasion by going to a kind of a sacred place. And we hiked up the Inca Trail in Peru and over the Sun Gate and down into Machu Picchu. And the world that I wake up every morning trying to create, and I know we're all trying to create, is a world where everybody can do what I did on this 5th anniversary. I hugged my daughter because she survived that suicide attempt and frankly, a couple more. And she's now changed her career profession from PR to mental health. She's getting her master's in social work. And she believes, and I believe, that working together at all these levels, local, regional, national, global, in this mental health moment, we can make the change and we can answer the call, not the phone call, but the call of history on mental health. Thank you very much, and I know we have a few more minutes for questions. I think Amanda's going to help me curate those. And while we're waiting, just thank you, the organizers, for having this conversation. And I look forward to hearing the panels that are next. So we got to get going, got to get started. Okay, Amanda, help us out here.
Thank you, Craig. That was a amazing presentation. Your story is so moving. I just wanted to start out. I think that, so often people don't really know what they need or what to ask for until they find themselves in a place of crisis. And from your experience, when you look back in retrospect, are there certain things that you wish your employer or your community had provided that you now know would have been really helpful in the moment?
Great question. I'm going to answer two different questions. One is, what should you be aware of? So the first, as I mentioned in the technology example, one of the first things to go is your sleep. So if you start seeing your sleep patterns disrupted, that sometimes sets off a chain reaction that then triggers your genetic underlying disposition to whatever it might be, depression, anxiety, addiction. So, look for those kind of things. Look for emotional swings that are unusual. Look for loss of joy and ability to do things that you need to do or that you enjoy doing. And so be mindful of that. Look for that in your kids and have conversations about it. Let's just start talking about that. Now, your question really goes to the system side of it. I would have loved to have had a supervisor who had already, we were already in a conversation about this as part of just normal life. We all talk about breaking our bones, and we talk very openly about cancer, and we wear pink ribbons, and it's out there. There's not as so. But with mental health, oftentimes you're afraid that if you're not performing, people are going to think, well, you can't cut it, so I'm going to put you on a performance improvement plan and move you out of the organization. That happens to this day in every organization on the planet. That's got to change. So that'd be one thing that'd be helpful. This integration of primary and specialty care is another big gap. Often you have to wait 3 months or longer to get an appointment with a psychiatrist. And then you get there and you find out they don't even do what you need, because it's not quite the right fit. So now you're back. So it can take months and years to get the right kind of care in place, and it shouldn't be that hard. So those are some of the things we're trying to change. And I mentioned some of the other gaps in the system that I wish were different. We are now, through our employee group, we now have a sort of a built-in peer support mechanism. So, at our company, if you're an ally of LGBTQ, you can put a little rainbow, what do they call those hairy things, squingies or whatever, on your doorknob, or you can put it on your signature block, and people know they can come talk to you about their LGBTQ issues and have a safe conversation. We're now doing the same thing with mental health. That we call them the mental health diplomats. These are people you can approach and have a safe conversation about the ins and outs of this field and how to navigate it without having to reinvent the wheel every time. So those are some of the things that I wish we had and we're trying to build now.
Great, thank you. I have one coming in from the audience, and it's about support, and I was wondering maybe you can give some feedback on what we're doing well related to support and maybe where there's opportunities for improvement of just support, health education, training, not just among professionals, but among our community, whether we're talking about our workplace or the community outside the schools and our neighborhoods, things like that.
Well, there's a lot going on, right? There's a lot of money pouring into these anti-stigma campaigns. There's a great event coming up. You look up the Mental Health Coalition in the United States. It's kind of a grouping of all these organizations. And so what we're doing is a lot of good voices. And there's tons of mobile apps now. But the Achilles heel of the mental health community is fragmentation. And so what we need to do is bring these voices together. That's why the Mental Health Coalition is so important in the United States. Because there are very conflicting messages. I just had a family member go through a serious mental illness crisis, and trying to get the family on the same page, because everybody was hearing different things about, what's the right approach? Is it really even a medical thing, or is it really just a character thing? And so we've got to have a better, clearer, combined message. So as you speak about this, speak your individual truth, but look for those kind of common themes that seem to unite us and bring people together. And the ones I would point to are, number one, this is very common. It's part of the human condition. 1 out of 4 people at some point, and many analysts think it's more than that. Every family is affected. Normally when I get these talks, I ask people to raise their hands, and every hand goes up in the room, whether it's 1,500 people or 500 or 50. So it's very common. It's highly treatable if you do it early. That would be the other message I'd say. Don't be fatalistic about these conditions. Even the most severe ones, the most serious ones, have treatments that work today, and there's better stuff coming. So let's. We're talking more about it. Great. But let's try to have a unified voice, so we're not confusing people more than we're actually helping.
Thank you. And I don't know if you from the audience, we've received lots of just thank you comments for sharing your story, for shining the light on the stigma. We're part of a great community here of employers and our associate members. And I think as we kind of close out, the last question would maybe be, how can us as a coalition, our employer members, how can they partner with you, with Johnson & Johnson, with other organizations that are doing great work in this area?
Well, I do want to mention that I'm on the board of the DMAX Foundation, which works with students on to create conversations that matter at universities around mental health. So look for local nonprofits like the DMAX Foundation to support. So my favorite children's book is Horton Hears a Who, Dr. Seuss. It's not one of the ones that's problematic. But you might remember Horton was an elephant, and he had these big ears, and he had a little dust speck on the top of a clover, and he could hear voices that no one else could hear on the dust speck, and he's trying to get everybody to hear that there's people there. Don't drop those speck into this vat of boiling oil. And he's imploring all the members of this dust speck community to speak up. And they're all banging their pots and yelling, and they finally find a little child who hasn't said anything yet, and that child makes a noise like a bop or something, and that's the straw that breaks through and everyone can now hear the community. So the message I want to leave you with is, we are in this mental health moment. These moments do pass, the windows do close, but I'm very optimistic, especially if all of us raise our voice in whatever way that's possible. In your organization, in your own storytelling, in your philanthropy. You never know if you're going to be the one who puts this over the top, but I think it's a magical moment. I'm here to serve. Please contact me. You can contact me through Carl and Amanda and the team if you have any questions. You want to, find ways to contribute, or you have some great ideas that maybe we can help scale up. We're trying to transform mental health care worldwide, and we need all the help we can get. Again, thank you for the opportunity to talk with you all today, and I look forward to the rest of the events this morning. Afternoon.
Thank you so much, Craig. We appreciate it. Again, thank you for your story with all of us. I'm sure you'll have people reaching out to you after this. I just want to thank everyone in the audience for engaging with us in the chat and the Q&A. We do have another panel coming on in just 1 minute. So we will be taking a break, going back to the table format just to announce our next raffle prize winner, and then to bring our speakers up on stage. So thank you, and we will see you again in just a minute.